Hello, my name is Ashlyn. Today I'm going to be doing a intramuscular injection. I have my medication here, my needle, which is a 25 gauge by 1 inch, my syringe, which is a 3 ml syringe, alcohol pads and gauze, and my gloves. So the medication that we're going to be administering today is going to be morphine sulfate. It's 6 milligrams IM for 1 dose is our order. What we have on hand is morphine sulfate 4 milligrams per ml. We do have to do dosage calculation to get the correct milliliters for the injection. How I would get this would be 6 milligrams divided by 4, which gives us 1.5 milliliters that we are going to be drawing up and injecting for our patient. So after we have done our dose calculations, I'm going to go over the 6 rights of medication administration, which is right patient, right drug, right dose, right route, right time, and documentation. Once I have gathered all of my supplies, I'm going to go ahead and go into my patient's room. I would go ahead and enter the patient's room, provide the patient privacy, perform the hand hygiene. Hello, Mr. Smith. My name is Ashlyn. I'll be your nurse today. Can you confirm your name and date of birth for me? Thank you. I would go ahead and also verify with his wristband. Mr. Smith, do you have any known drug allergies to medications or food allergies that we should be aware? Nope, sounds good. Okay, so it looks like your doctor went ahead and ordered morphine sulfate to be injected IM for you intramuscularly. Morphine is a pain medication that reduces the feeling of pain by interrupting the pain signal between your brain and your body. Some common side effects to look out for would be diarrhea. Some patients have some agitation and nausea. Adverse effects would be respiratory distress and black tarry stools. If you do experience any of these, please let us know so we are able to help you. I'm going to go ahead and draw up my medication now. I would go ahead and perform hand hygiene, don my gloves. Okay, so now that we have our gloves done, we're going to go ahead and next draw up our medication. I'm going to start by cleaning our medication vial. And then I'm going to take my syringe, and I'm going to take my needle, and we're going to attach this, twisting it on. We are going to inject air into our vial first. So again, we are pulling back the I'm sorry, I'm blinking now. We're going to draw back and just inject in air. So we are drawing back 1.5 of air, and we're going to just inject this into our vial. And we're going to invert, and we're going to draw out the medication morphine, which is a 1.5 milliliters. And if there's any air bubbles, we just kind of inject back in a little bit. Perfect. And I'm just moving this needle back here so you can see that we're just going to just... Okay, so we do have a little air bubble. Okay, so now we have 1.5 of our medication there. So now that we have our medication drawn up, we're going to go ahead and verify the site that we will be injecting. So today we're going to be injecting into the ventrogluteal site. So Mr. Smith, we're going to go ahead and inject this into your glute area. I'm going to go ahead and expose the area if that's okay. Okay, perfect. So I'm just going to take a look at your skin, make sure there's no bruising, no tenderness when I'm touching you here. Okay, perfect. And I don't feel any lumps. The patient doesn't have any pain. There's no bruising. There's no visible infection or any discoloration on the patient's skin. So this looks great. Next, we're going to verify the correct area our placement of the injection. So in order to do that, we have to find the greater truncanter, which is the top of your femur. And how we do that is we just locate it here with the palm of our hand. Once we feel that there, our hands will just drop. Your thumb is going to always be pointed towards the front of the leg. Your index finger is going to go towards the iliac crest or the buttock area as well, and your thumb is just going, and thumb and other fingers are just going to go to the side. Your fingers are going to create a V, and this is where you're going to inject, is within the V area. Once we have verified this is the correct area that we're going to inject, we are then going to cleanse the area, and we're going to just do in a circular motion. Once that is cleaned and we have thrown away everything, we are just going to let this air dry. You're not going to fan it, you're not going to blow on it, you're just going to naturally let it dry. Once that's drying, we are now going to inject, so I'm just going to remove the cap. We'll throw that away. I'm just going to grab the muscle and create it here, and I'm going to go ahead and make sure that I have the correct placement, and we're just going to go and inject at a 90-degree angle. Once we inject, I'm going to go ahead and take my 2 fingers that are on my non-dominant hand just to stabilize the syringe, and with my dominant hand I'm just going to go ahead and inject the medication. And we are injecting the medication at 10 seconds per milliliter. And once that injection has been completed, we're just going to leave the needle in for about 10 seconds. Okay, once that 10 seconds is up, we're going to go ahead and carefully withdraw. We are going to immediately put this into the sharps container, and we're going to place a gauze over the injection site. You do not want to massage the area. You can go ahead and apply a bandage if the patient requests. Everything looks great. We'll go ahead and take off my gloves. Mr. Smith, how are you feeling? You feeling okay? Perfect. I'll go ahead and apply hand hygiene. Okay, Mr. Smith, I'm giving you your call light. If you need anything or if you start not feeling just quite right, just please give us a call and we'll come in and help you. So after this, I'll go ahead and again perform hand hygiene, and I'll go and document my procedure. Thanks.